Hey YouTube, it's Carla, Changing 56, and today is Sunday, July the 13th, 2014, and, I'm looking a little rough, but hadn't gone anywhere today. Like I said, it's Sunday. Normally I go to church, but I'm still home resting, because I'm going back to work tomorrow. And I know some of you are going to say, you don't need to go. I really feel okay, and I've been resting since I got out of the hospital. The deal is, if I don't work, I don't get paid, and I lost a whole week's work last week. So I really need to work, and that kind of just, it is what it is. So that's tomorrow. I'll go to my afternoon shift at 3, and I'll work 5 hours tomorrow. So I still have time to rest tomorrow, and I feel, like I said, I feel okay. And it's kind of up to me as to, when I feel okay to do that. Let me see. I'll just go ahead and do my update. I don't even know what week this is, and I think I'm not going to do weeks anymore. I think I'll just do months. This would be month like 25 post-gastric bypass RNY. I'm 2 years and 1 month out. As of today, I weigh 118. When I got out of the hospital, I had gained like 5 pounds, but I knew I didn't freak. I knew it was water weight because they pumped me full of IV fluids, and that went away quickly. So I'm back at my, where I was last week. So things are going to change, though, a little bit, and I'm going to talk about that. But the doctor, I think I said in my last video, he pretty much, laid it on the line. I've got to take the medicines for the rest of my life, and I'm okay with that. And I'm going to start cardiac rehab so I don't go hog wild and start walking and doing stuff too much. And I know I'm going to have to monitor what I do and work myself back into things. But like I said, I feel okay. Now, the food issues. I still have a call in to my surgeon. I talked to my nutritionist. I still don't have official results from my upper GI. I'm still waiting to hear what my surgeon has to say. But basically everybody says I am intolerant. Intolerant of what? Well, pretty much I am whey intolerant. And that has become even more abundantly clear this weekend. I have eaten my last Quest bar. Now that breaks my heart because I love them. But Friday night I had one, and I was so sick. I mean, sick as a dog. I mean, dumping, whatever you want to call it. I mean, I have these pains in my stomach that feel like somebody is wrenching it, like you would wring out a wet towel, and a knife sticking in it on top of that. Besides the rapid heartbeat, the heat, the hot flashes, the nausea. I mean, and this one lasted for about 3 hours. It was not pleasant at all. And I had not had anything else, no other protein, whey protein or anything like that. Now, whether I'm gluten intolerant and lactose intolerant, I don't know. I'm still eating Greek yogurt, and I'm not having any problems with that. I'm not totally sure. I'm kind of waiting for, a confirmation from my surgeon. But pretty much what I plan to do is just totally detox from everything. I talked to my GNC. I went by there yesterday. I went and had my nails done yesterday, and it's right next door. And I went in there, and the girl, I mean, they all know me because she said they had a new employee. She said, "Here's our best customer." Of course, we're friends on Facebook, and her brother was one of my students, so we know each other. And she said, "Of course we'll take your Quest bars back." So I have like 2 dozen that I haven't eaten, so I'm going to take those back. I have ordered some rice protein. I'm not sure I'm even going to really use that. I may return that because I'm thinking I am totally going to detox, and I'm going to do this. It makes total sense to me, It's Dr. Matthew Weiner. He is a bariatric surgeon from Michigan. He also does other forms of weight loss, but a pound of cure it's called a metabolic reset diet, and basically all it is non-processed foods, fruits, vegetables, nuts, and protein. For the first 2 weeks, you do a pound of vegetables and fruits a day, and I know other people are doing this and they've talked about it, but it's a pound of, at least a pound of fruits and vegetables a day, half of which can be raw. For a woman, 3 servings of protein a day, which is about 3 to 4 ounces, and one of those needs to be a vegetable-based protein, 2 of which can be meat. 2 servings of nuts a day, raw nuts. Now, I have dumped with raw nuts before, with raw almonds. So I guess for me, I'm going to try like walnuts and pecans. I think that may be my best option. I can also have natural nut butters, and I can have unsweetened almond milk. Okay, and 1 serving of fat, which is like extra virgin olive oil. No dairy, no wheat of any kind, and no processed foods, and no artificial sweeteners. So basically we're talking all natural, and I don't have a problem with that. And I mean, I love fruits and vegetables, and I think I'm going to be fine with this. I will miss the Quest bars. I will, miss the other sources of protein that I've been getting from artificial sources. But for my health and my well-being, I don't have a choice. I mean, I had somebody question what I was doing the other day, and I said, I don't have a choice. I mean, I get deathly sick when I eat this stuff. Now, it's okay. I mean, it passes, but you're also doing damage to your body if you continue to do this. I mean, when you have like lactose and gluten intolerances, if you continue to do these things, no, it's not going to kill me. I'm not allergic to these things, and I don't have an allergic reaction. But what I just explained to you, these pains that I'm having, and inability to function for 2 to 3 hours, is not good. I mean, that's not good for anybody. So, my body, for whatever reason, has become super sensitive to these things. So, I've been documenting, and, kind of got derailed this week with my little heart episode. And I do think my heart had a lot to do with part of it, but, that issue has been pretty much taken care of, and I'm still doing it. I thought, well, I'll just eat with the Quest bars I've got, and then when they're gone, they're gone. I won't do any more. Well, after Friday night, no more. I was sick. So, no more. Alright, speaking of my heart, let's see if I can show you this. See if you can see. These are my vessels. Right here, main artery is where I had 80% blockage. You can see where it's narrowed there. That's what it looked like before. After, you can see after the stent placement, you can see that it's open. So there you go. That's what I had done this week. I had a stent put in. And he said, and I think I'm just repeating myself partly, but, he told me the other day when he crawled me and chewed me up and spit me out, I don't care what any other doctors tell you. They have to check with me first. I don't care what your numbers are. I don't care that your cholesterol is normal. Your heredity and your predisposition to having these blockages is all important. You've got to stay on the medicine. And when you look at my heredity, when I first talked to him, 10 years ago, I started telling him my history.
Houston, we have
and
a problem.
Well, I got a message. And when, and that's even changed even more now, but at that point in time, you know, grandparents, aunts, uncles. I had an uncle that died of a heart attack at 50. I had my grandmother, my daddy's mother, died of a stroke at the age of 49. You know, that was kind of the nail that you know, sealed it for him when I told him that one. And he said, "Your heredity is, Houston, we have a problem. You know, it's definitely a problem for you." So I will be taking, you know, an aspirin a day, which can be a problem. I'll just have to monitor and take acid reducers for my pouch, a baby aspirin a day for the rest of my life, cholesterol meds, Zocor or Simvastatin or whatever the generic is for the rest of my life. I'm taking Effient, which is a Plavix-like drug, but it's stronger. And I am also taking Lopressor. Those are my 4 new friends. The Plavix or the Effient, he said I would take for 6 weeks until I see him again, and then he'll change me to Plavix, and I'll do that for a year. And then after a year, we'll discuss me coming off of that. So it is what it is. And this is probably, it's already 11 minutes long. I didn't mean for it to be this long. But I needed to talk to you about my new plan and my intolerances and my heart. So that's pretty much it. As far as weight loss surgery goes, as far as my weight goes, all of those things are good. What I do know from the tests, all the tests that I've had done in the past 2 months of my pouch and my, you know, everything else on the inside, all of that's working fine. No problems there. So I'm good as far as that goes. Just got to tweak things and get to feeling better again and getting back on the road. I am going to go to cardiac rehab just because I know myself, and I'll get out there and start and stop walking. So somebody really wants to get in touch with me. Anyway, I'll get out there and start walking too much, and it's too hot right now to do that. So I'll do the cardiac rehab. It lasts for 3 months. I go 3 times a week, and they'll monitor. They put a heart monitor on me, and they monitor what I do. So that will be good. And I think I can walk some the other days of the week from what I remember from what I've done before, but it'll need to be early in the morning or late at night when it's not so hot and humid. Okay, so we're at 13 minutes. I think it's time to end this. Hope you all have a great week. So this will stand for my normal Monday update, which nothing's been normal with me lately. Just go out there and rock your journey. I'll talk to you later. Bye.